Hello, we are the Knowles Insurance Agency husband and wife team, Richard and Samantha Knowles. We've had the great privilege of serving Medicare beneficiaries for over 16 years. Congratulations, you're Medicare eligible. You have your red, white, and blue Medicare card. Now what? No worries. I'm going to show you a couple of options to reduce some of those out-of-pocket costs that A and B don't cover. But let's look really quickly at an actual Medicare card. So let's examine this Medicare card. This is a sample, obviously. Yours is going to have your name, your Medicare claim number, your gender, your A and B effective dates. One thing I want you to notice is that there is no network designation on this card. There is no HMO, there is no PPO. That's because original Medicare A and B offer you nationwide coverage to see any doctor, any provider that accepts Medicare without a referral. Now, what exactly does the hospitalization Part A and the medical Part B cover? Let's get into that. Part A, hospital insurance. Let's look at the second column. That is what the Medicare beneficiary is still obligated to pay out of their pocket. So there's a hospital deductible, $1,364. That's per benefit, period. Then there are co-payments. If you're in the hospital for a single stay longer than 60 days, you would be obligated to pay $341 a day for days 61 through 90. If you're in the hospital past 90 days, you would pay $682 a day for days 91 through 150. The first 20 days of skilled nursing is free with Part A, but after that you pay $170.50 per day if you're in any time from days 21 through 100. Most people receive a zero premium Part A. That's because they've worked 10 years or 40 working credits and paid their FICA, or their spouse has. If your work history in the United States is less than 40 quarters, you'll see the breakdown. You still can purchase Part A. Part B, medical insurance. There is a calendar year doctor deductible of $185. The premium is $135.50. That's the base premium. If you are a higher tax earner, you could have to pay a higher premium. It's called IRMA, and that would be on top of your Part B. But the majority of people pay $135.50 premium per month for your Part B. Then you're responsible for 20% up to no limit. 20% of doctor visits, outpatient therapy, durable medical surgeries, operations, chemotherapy, radiation, keep going. 20% up to no limit. So clearly Part A and B don't cover everything. You could have some pretty substantial costs coming out of your pocket if you just have your red, white, and blue Medicare card. So people choose to limit their out-of-pocket costs by enrolling into either a Medicare Advantage plan or a Medicare supplement, also called a Medigap. We're going to talk about Medigap first. Medigaps supplement original Medicare. What that means is they offer the exact same nationwide flexibility and freedom for you to see any provider without a referral. A Medigap is a health insurance policy, and it's sold by private insurance companies. They offer different sets of standardized benefits. They are lettered plans. I'm going to show you a chart here in just a second. One plan might cover the co-pays and the deductibles, another might cover the co-insurance, or a third might cover a combination of all three. There's usually about 10 different Medigap plans. It depends on your state, but let's take a quick look. Let's look quickly at a chart. This is on page 70 of your Medicare New 2019 book. You can look at your book, or you can just look at the screen. They are lettered plans, and they're standardized. What that means is a Plan G, for example, is going to offer you the exact same benefits no matter what insurance company you choose to buy the plan from. They are standardized plans. So let's just look. The percentages are showing you what coverage they fill in. We just went over A and B, and so there's a lot of out-of-pocket costs. So let's look at the first. Let's look at a Plan G. It's what we help the majority of people with. Plan G says, I'll cover 100% of the Medicare Part A coinsurance and hospital cost. Second row, it says, I'll cover 100% of the Medicare Part B coinsurance or copayment. So keep looking down. You'll see 100%, 100, 100, you go all the way down. Now, there is a blank for the Plan G next to the Part B deductible, but remember, we said that's $185. That's a calendar year deductible. So after you pay your obligation on your G, $185 for the calendar year, your Plan G would pay 100% for any Medicare covered services. Also notice the Medigap plans cover an additional benefit original Medicare does not cover. It is foreign travel. So if you're traveling abroad, you have up to $50,000 in a foreign travel benefit. And that's for, let's see, C, D, F, G, M, and N. Now, the average premium for a Plan G Medigap plan is anywhere from $100 to $150. That's for a 65-year-old male or female, and the prices vary by state. Now, the Medigap premium is in addition to your Part B premium of $135.50. A Medigap plan does not have drug coverage built in, so if you need drug coverage, you will have to go attain that on your own. The average premium for a drug plan is about $30. Medicare Advantage plans, also called Part C of Medicare. These are smaller local plans with networks of providers. A network might include a few counties or an entire state. These plans are also offered by private insurance companies, and they offer the exact same services as original Medicare, but they'll usually add some extra benefits like dental care, vision, wellness, and most include a drug plan for no extra cost. When you join a Part C Medicare Advantage plan, this is important to understand that you're no longer with original Medicare. So no more nationwide coverage. When you enroll into a Medicare Advantage plan, you're agreeing to use their network of providers and get referrals if the plan requires that. In return, you're going to pay a low or zero premium, and you really only pay copays when you use the plan. So you pay as you go. Now, that sounds pretty good if you remain healthy. However, I always like to point out that there is a max out of pocket on a Medicare Advantage plan. Anywhere from $3,000 to $6,500, it depends on the plan. So if you start using the Medicare Advantage plan quite a bit, you get some chronic conditions, heart issues, even cancer, now you're paying 20% coinsurance for all your radiation and chemotherapy and all diagnostics. You could actually meet your out-of-pocket $3,000 to $6,500. So now the low cost or zero premium Medicare Advantage ends up being more expensive than a Medigap. In that same situation, a Plan G Medigap, you would have paid the monthly premiums times 12, so annualize your premiums, and then the only out-of-pocket on a Medigap Plan G is the $185 deductible. Then your Plan G pays 100% after that. Another couple of pointers I want to make clear. You cannot always go to a Medigap later on. Let's say you were on a Medicare Advantage and you said, I want the better health coverage of the Medigap plan. A Medigap plan is fully underwritten. It has quite a few health questions. So if you could not health qualify, if you were in the middle of anything or in the last 2 years you had any major complications, heart or cancer, or you had any major chronic conditions, you probably would not qualify for the Medigap. You can almost always go to a Medicare Advantage plans. Those are easy to qualify for. They only have one health question. The disqualifying health question for the Medicare Advantage is, do you have end-stage renal disease? So most people can qualify for a Medicare Advantage, but not necessarily for a Medigap. So we always say, please take your time in choosing your plan and reach out to us anytime. We have over 30 different insurance companies, and we would certainly love the opportunity to serve you. We are the Knowles Insurance Agency, and I'm Samantha Knowles.